Vital exhaustion is a term that Dr. Appel's coined back in the 1970s, but it is this feeling of demoralization, fatigue, increased fatigue, and irritability that patients experience prior to having a first-time cardiovascular event. We did a meta-analysis, and looking at this term in itself, it picked three things, and we looked at studies just looking at plain fatigue, and we also looked at patients who have depressive symptoms, also complain of fatigue, and we wanted to see, is there something between these three things that make it a distinct characterization of fatigue, and is it correlated, is there association with first-time event of cardiovascular disease? And that first-time event was either a first heart attack, a first angioplasty, or even a CABG. We used a specific questionnaire that Appel's had created. It's called the Maastricht questionnaire. He coined a Maastricht based on the origin that it came from, which is Maastricht, Netherlands, and looked at specific questions. And these were patients that he looked at that were otherwise healthy. The first study that was done looked at, these are prospective studies, so they were college students who didn't have any other health problems, and they watched them over time, and they saw that the otherwise healthy just had this prodrome of just feeling tired or fatigued. It included unable to sleep, and there was no exactly inciting stressor that caused this. They just felt something come along and they couldn't really explain why. We also looked at the Maastricht study that kind of started this whole thing back in the 70s, looked at bus drivers who otherwise were healthy, also had this feeling that they had a few weeks prior, so otherwise they were just going about their day, and then a few weeks prior had these feelings. What we saw is that fatigue in itself, even on its own, whether it was very broad, had a significant association, but vital exhaustion had an even stronger association. Then we also looked at patients who were depressed, who also could have a very similar sort of presentation, and we were able to control for that as well, and still there was a significant association between vital exhaustion and first-time cardiovascular event. We're trying to, I guess, encourage just within clinical cardiology is that just as we look at other risk factors such as high cholesterol, smoking, family history, which have been proven, this is kind of new, and we don't really have any parameters or any physiologic studies that show that this is either a warning sign or a cause, but what we can say is that it is associated. And the thing also is that there isn't enough scientific evidence out there, but whether this is part of the whole prodrome of, it just happens that these patients also tend to want to smoke more, tend to sleep less, tend to not be able to adapt to just chronic stressors, which is also the same sort of profile that people who have a first-time cardiovascular event. So we're not, right now we're not able to tease that out, but we want to encourage cardiologists to talk about these things as they're talking to their patients about what their cholesterol level is or smoking cessation. If you go to the doctor and they say, that maybe you are having trouble adapting to the stressors in your life, or there is no stress but you're feeling these things, then what we would like to do, and that's what we're actually doing in our hospital with patients who are coming in with a first-time heart attack, is we actually refer them for a psychiatry eval just to see if there are any other issues going on. We also can maybe seeing that maybe this is something that this could be the early signs of something else going on. We could send them for an early stress test. Early meaning they didn't come in with typical chest pain, shortness of breath, but this feeling of, I just don't feel like myself, I'm incredibly fatigued doing the same sort of activities that I used to do. We can actually say, well, maybe, there's a good enough reason based on the association that we found. Let's send them for a stress test and see if there's anything on that stress test. I would say that looking at whether if this is sort of an emotional sort of, you can't handle as much as going on, I think a psychiatrist could able to tease that out just looking at, there are some basic things that depressive patients seem to kind of have, and if they do fit all those parameters, then that is the thing that we would be focusing on more, and along with just also preventing what we know causes cardiac disease. So maybe those patients need to be on an antidepressant. Whereas if you don't fall into any of those categories, and you're still feeling these things, then yes, exercise encouraged for everyone and anyone, but I think more importantly, especially since we saw that there was a first time incident with an event, it's really important to see, do these patients have plaque, an underlying plaque burden that no one else has seen before? Their cholesterol levels appear normal. They're not diabetic. They don't really have other risk factors, but they're showing signs of fatigue that's unexplained. So those patients, I think, whether they might need a stress test or a coronary cath, would be at least you'd feel a little more confident about going that direction, despite the physiologic parameters they don't fit that picture.